I want you to open your medicine cabinet right now, or your kitchen cupboard where your supplements live. I want you to look at what is in there. The vitamin D capsule, the calcium tablet, the fish oil soft gel. These 3 supplements appear in more senior medicine cabinets than almost any others. They are recommended by doctors, pharmacists, television health programs, and well-meaning family members. They are purchased by millions of adults over 60 every single month. They are considered not just safe, but actively protective. And for each one of them, there is a dose at which the protection reverses. A dose at which the supplement you are taking to protect your heart, your bones, and your brain begins doing the opposite. A dose at which the thing you believe is helping you is quietly working against you. Today, I'm going to show you exactly where that line is for 3 of the most popular supplements taken by adults over 60. I am going to tell you what the excessive dose is doing inside your body. I am going to show you what the research actually says. Not the marketing, not the bottle label, not the advice of someone who sells supplements. The clinical research. And I am going to tell you what the right dose is, so that if you choose to continue taking these supplements, you do so in the range where the evidence actually supports benefit rather than harm. I'm Dr. Richard Whitfield. I have spent over 27 years in internal medicine, working specifically with adults managing chronic health conditions after 60. And supplement toxicity, specifically supplement toxicity from products that are widely considered safe, is one of the most consistently under-recognized clinical problems I encounter in this age group. Before we go through all 3, drop your age in the comments and tell me which supplements you take every day. I read every comment. And I guarantee that by the end of this video, at least one of the 3 I describe will be something sitting in your cabinet right now. Stay with me through all 3, because the 3rd supplement is the one most people are completely shocked by. It has been marketed as a cardiovascular superfood for 30 years, and at the dose most people take it, recent research suggests it may actually be increasing cardiovascular risk rather than reducing it. Let me begin. Supplement 1, vitamin D. Vitamin D deficiency is genuinely widespread in adults over 60. That part of the conventional health message is accurate and important. The skin's ability to synthesize vitamin D from sunlight declines with age. Seniors spend less time outdoors, and vitamin D plays critical roles in immune function, bone density, mood regulation, and cardiovascular health. Supplementing vitamin D when you are deficient is appropriate and beneficial. But here is where the conventional message stops being accurate. More is not better. And the doses at which most adults over 60 are supplementing vitamin D have moved far beyond the threshold where supplementation is beneficial and into the range where it is potentially harmful. The recommended daily allowance for adults over 70 is 800 international units per day. The tolerable upper intake level, defined as the highest daily intake unlikely to cause harm, is 4,000 IU per day for most adults. The most commonly sold vitamin D supplement in pharmacies and health food stores is 5,000 IU per capsule. Some popular formulations are 10,000 IU. Many adults over 60 take 1 or more of these daily, believing that higher doses provide greater protection. The research does not support this belief, and for several specific outcomes, it suggests the opposite. Vitamin D toxicity, called hypervitaminosis D, occurs when vitamin D blood levels become too high. Because vitamin D is fat-soluble, it accumulates in body fat and is not cleared quickly by the kidneys. When vitamin D levels rise excessively, they trigger a cascade that increases calcium absorption from the gut and decreases calcium excretion from the kidneys. Blood calcium rises. This is called hypercalcemia, and hypercalcemia has direct effects on the heart. It disrupts the electrical conductivity of cardiac cells. It can trigger arrhythmias. It increases vascular calcification, the deposition of calcium within the walls of arteries. And arterial calcification is directly associated with increased cardiovascular risk, increased arterial stiffness, and reduced coronary blood flow. A large-scale study published in JAMA Cardiology examined the relationship between vitamin D supplementation dose and cardiovascular outcomes. The study found that adults taking more than 4,000 IU of vitamin D daily showed no cardiovascular benefit compared to those taking 400 to 800 IU. And a separate analysis published in the New England Journal of Medicine found that very high-dose vitamin D supplementation was associated with increased fall risk and increased fracture risk, the opposite of what most seniors are taking it for. The correct approach to vitamin D is not to take a high-dose supplement because vitamin D deficiency is common. It is to measure your actual blood level of 25-hydroxy vitamin D, the standard clinical test, and supplement specifically to bring your level into the optimal range of 40 to 60 nanograms per milliliter. For many adults, this requires only 1,000 to 2,000 IU daily. For some, a lower dose is sufficient. For a small number with severe deficiency, a higher dose may be needed initially under physician supervision. If you have been taking 5,000 IU or more of vitamin D daily without having your blood level tested in the last 12 months, ask your physician to check your 25-hydroxy vitamin D level at your next appointment. The test takes 1 tube of blood, and it will tell you whether you are supplementing into the beneficial range or beyond it. Supplement 2, calcium. Calcium supplements are one of the most universally recommended supplements for adults over 60, particularly women. The logic is straightforward and well-intentioned. Bone density declines with age. Calcium is essential for bone density. Therefore, supplement calcium to protect bone density. The problem is that calcium supplementation, specifically supplemental calcium taken in pill form, has a different biological behavior from dietary calcium in food, and the difference is clinically significant. When you consume calcium from food, dairy, leafy greens, fortified plant milks, sardines, the calcium is absorbed gradually, in the context of other nutrients, at rates that the body can regulate. When you take a calcium supplement, you deliver a concentrated dose of calcium into the bloodstream within a short window of absorption. This produces a transient spike in blood calcium levels, and during that spike, research has shown that calcium deposits begin forming more readily in soft tissues, including the walls of arteries. This process, called arterial calcification or vascular calcification, is the same process that stiffens arteries, reduces their flexibility, and contributes to cardiovascular risk. A landmark meta-analysis published in the British Medical Journal, combining data from multiple randomized controlled trials, found that calcium supplementation was associated with a statistically significant increased risk of heart attack in the adults studied. The analysis found approximately a 30% increased risk of myocardial infarction associated with calcium supplement use. The effect was not seen with dietary calcium from food, only with supplemental calcium tablets. This finding was controversial when first published. It has since been replicated and extended in multiple subsequent studies. The National Osteoporosis Foundation and the American Heart Association have both responded by recommending that calcium needs, to the extent possible, be met through dietary sources rather than supplements. If supplemental calcium is genuinely necessary because dietary sources are insufficient, the research suggests that calcium citrate is better tolerated and less likely to produce the vascular calcification concern than the more commonly sold calcium carbonate. And splitting the dose, taking no more than 500 milligrams at one time rather than a large single dose, reduces the magnitude of the blood calcium spike and correspondingly reduces the vascular calcification risk. If you currently take 1,000 milligrams or more of calcium as a single daily supplement, this is the most important supplement conversation you need to have with your physician. Supplement 3, and this one surprises everyone. Fish oil, omega-3 supplements. Perhaps the single most universally celebrated supplement of the last 30 years. Recommended by cardiologists, promoted by fitness culture, purchased by hundreds of millions of adults globally. And I want to be careful here, because the full picture is genuinely complex. The research on omega-3 fatty acids in cardiovascular health is not uniformly negative. For people with established cardiovascular disease, for people with very high triglycerides, for specific clinical populations, high-dose prescription omega-3 medication has shown genuine benefit in specific outcomes. What I am specifically addressing is the over-the-counter fish oil supplement taken at the doses most seniors take it, which is typically 1,000 to 3,000 milligrams of fish oil per day, because they believe it is protecting their heart. 3 specific concerns have emerged from the research. First, the oxidation problem. Fish oil is extremely vulnerable to oxidation. The omega-3 fatty acids in fish oil, particularly EPA and DHA, are among the most chemically unstable dietary compounds studied. When fish oil oxidizes, the omega-3 compounds convert to lipid peroxides and aldehydes, compounds that are directly pro-inflammatory rather than anti-inflammatory. Multiple studies analyzing commercially available fish oil supplements have found that a significant proportion of products are oxidized to a degree that the researchers classify as above safe consumption limits by the time they reach consumers. A study published in Scientific Reports analyzed 171 commercially available fish oil supplements and found that over 80% exceeded at least one oxidation safety limit established by international food safety standards. An oxidized fish oil supplement may be producing the opposite of the intended anti-inflammatory effect. Second, the bleeding risk. Omega-3 fatty acids have documented antiplatelet activity. They reduce the ability of platelets to aggregate and form clots. In adults over 60 who take aspirin, warfarin, clopidogrel, or any other anticoagulant or antiplatelet medication, the addition of fish oil supplementation can produce additive bleeding risk. This combination has been associated with increased rates of clinically significant bleeding events in multiple observational studies. Third, and most recently, the atrial fibrillation concern. A large randomized controlled trial published in the New England Journal of Medicine, specifically examining high-dose omega-3 supplementation, found an unexpected finding: a significantly higher rate of atrial fibrillation, which is an irregular heart rhythm, in the group taking omega-3 supplements compared to the placebo group. Atrial fibrillation is a clinically serious cardiac arrhythmia that significantly increases stroke risk. This finding has been replicated in subsequent trials and has prompted regulatory bodies in several countries to update their guidance on omega-3 supplementation. The effect appears to be dose-dependent, meaning lower doses show less of this risk. But it is a finding that every adult over 60 who takes fish oil supplements deserves to know about. What should you do if you currently take fish oil? First, if you take it alongside any blood-thinning medication, this conversation needs to happen with your physician at your next appointment. Second, if you take it for general cardiovascular protection without a specific clinical indication, the current evidence does not support continuing it at high doses, and the oxidation concern makes the quality of the product critically important. Third, if you continue supplementing, choose a product that is third-party tested for oxidation. Keep it refrigerated after opening, and check the smell regularly. Rancid omega-3 has a strong, unpleasant fishy odor that fresh, non-oxidized oil does not. And strongly consider shifting your omega-3 intake to dietary sources. Fatty fish consumed 2 to 3 times per week. Walnuts, flaxseed, which provide omega-3 in forms that are significantly less vulnerable to oxidation and have stronger, consistent evidence of cardiovascular benefit. If any of these 3 supplements described exactly what is sitting in your medicine cabinet right now, tap the like button and drop in the comments which one surprised you most. Your comment helps other seniors who are reading them understand that they are not alone in having taken these without this information. What to do after this video. 3 specific actions. For vitamin D, ask your physician to test your 25-hydroxy vitamin D level. Do not adjust your dose until you see the actual number. For calcium, shift toward dietary sources wherever possible. If you need to supplement, use calcium citrate, split into doses of no more than 500 milligrams, and do not take it at the same time as other medications. For fish oil, have an honest conversation with your physician about whether you have a specific clinical indication that supports continued use. If you have any heart rhythm concern or take any blood-thinning medication, this conversation is urgent. Your supplement shelf was built with good intentions. The products on it were chosen because someone told you they would help. What that person likely did not tell you is that the dose at which protection becomes harm is closer than most people realize for each of these 3. Today, you have that information. And if you want to understand which specific bedtime drink research has shown can lower blood pressure measurably by morning through 3 separate biological mechanisms, watch the next video on this channel right now. I'm Dr. Richard Whitfield. Stay informed, and I will see you in the next one.